Heartland Alliance for Human Needs and Human Rights was created nearly 125 years ago when Chicago was the fastest growing city in the world. Then, as is the case today, too many people living in poverty were struggling to survive. People rushed to our city to make new lives and livelihoods in the new world, but they often found themselves marginalized from the mainstream and vulnerable to legal, medical, or financial troubles. Heartland Alliance emerged as an organization that helped newcomers with housing, employment, community resettlement, and legal protection. We knew back then that our city was more vibrant and more successful when everyone had the opportunity to have a roof over their heads, a way to put food on the table, and were safe from injustice and exploitation. After the turn of the century, our organization continued to assist the poor and the vulnerable whose lives were upended by the events of the day. Events like migrating military personnel during World War I, the jobless and homeless during the Depression, those displaced from Europe by World War II, or Southerners flocking to Chicago in the post-war years looking for industrial jobs. What evolved from those years of on-the-ground work was our comprehensive approach, the recognition that those in need had multiple and complex issues, and all of them needed to be addressed and solved in order for them to live securely and thrive within our communities. They're the very things needed 125 years ago, and the need for them is just as great today. That's why we now provide a continuum of services: housing, healthcare, jobs, and justice, all things that are needed to keep families out of poverty and ensure that they are safe and successful. 125 years of experience has been our teacher, and it has made us experts in the field. That experience informs our programs, enabling us to expand our reach both into the Midwest and throughout the world. We are proud to have this 125-year legacy and look forward to the next 125 years of service. Simply put, our goal is to reduce the number of people living in poverty. Through our research and policy analysis, we believe we can reduce the number of those living in extreme poverty by half. Extreme poverty refers to those who live below 50% of the federal poverty threshold. In Illinois, there are 750,000 people who live in extreme poverty. For a family of four, that means they make less than $11,000 a year. We know that it takes a lot more money than that to keep a family housed, fed, and healthy. The services that Heartland Alliance provides helps these families keep a roof over their heads, have access to a doctor when they're sick, find jobs to support themselves and their children, and secure legal protection to keep them safe. Throughout our 125-year history, we know these are the very things people need to lift themselves out of extreme poverty and stay out of poverty for good. We have proven models that effectively respond to these emerging needs. But here's what we need to accomplish our goal. We need to harness private resources to build best practice models. While the realities of poverty remain constant, how we address those realities is constantly evolving. Private funding helps us innovate and develop new solutions to the most pressing issues of the day. Take, for example, our job training programs. We are workforce development experts and have created a variety of programs that help unemployed, underemployed, and hard-to-employ individuals get and keep jobs. Because of our successful models that we built from private funding, the state of Illinois turned to us when it wanted to create one of the largest job recovery programs in the nation, known as Put Illinois to Work. We helped nearly 30,000 low-income, unemployed, and underemployed Illinois citizens secure jobs to help them through tough economic times. Once we have our models built, we need to influence policymakers to adopt the strategies we know are successful. That's exactly what happened with the Put Illinois to Work program. The state of Illinois knew that Heartland Alliance was an organization with the expertise to put this program into practice. They knew we had a successful model because we had spent years talking to state officials and decision makers, trying to convince them that job training programs are critical to helping people secure employment and get out of poverty. Accomplishing our goal and ending extreme poverty isn't all that difficult. It just takes creative and new thinking, supported by the political will to get it done. We have 3 leverage points that make Heartland Alliance the leading anti-poverty organization in the Midwest. First, we are efficient. We keep our administration costs low. In fact, 90 cents of every dollar goes directly to programs for the most vulnerable members of our community. We are able to do this because we've centralized a lot of our back office services, things like human resources, finance, and technology. Having those services consolidated allows our folks who are on the ground focus on serving people in need instead of worrying about things like health insurance, billing, or a broken computer. Second, we are effective. Experience is our best teacher, and our work is informed by lots of experience. We've been active for nearly 125 years, and each year we serve more than 1 million people around the world. This effectiveness is rooted in 2 things: quantitative and qualitative data. Here's what that means. We have a research arm of our organization that is constantly mining data about the programs and the people we serve. The data they provide helps inform our programs and helps us achieve better outcomes. But while this quantitative data is invaluable, so is the qualitative data we get from the field. Our living laboratories and on-the-job experiences allow us to shape our programs to best serve our participants. Third, legislators and government partners see us as experts in our field. When there's a social problem that needs to be solved, we are often the one policymakers call to help figure out a solution. Let me give you an example. As the state of Illinois implements healthcare reform, more than 700,000 individuals will be newly eligible for Medicaid. Because of Heartland Alliance's experience providing health care to those who are homeless and living in poverty, the state has looked to us for insight into how to incorporate 700,000 new enrollees and handle technical issues like setting reimbursement rates and linking Medicaid with supportive housing. Efficiency, effectiveness, and expertise, that is what makes us successful today and will be our strength in the future. Heartland Alliance is effective because we are a data-driven organization. In other words, we use qualitative and quantitative metrics to measure outcomes and impact. Numbers are our driving force. For instance, we regularly monitor how many people we are serving, and we boil that number down to give a specific and accurate picture. For example, we monitor how many participants are seeing a doctor, a lawyer, or a mental health specialist, and how frequently those individuals encounter anyone within our organization. But even more important than the number of people served is the positive difference that we've been able to make in our participants' lives. For example, a homeless individual with diabetes may visit our health clinic once a month and a case manager twice a month. But those numbers are meaningless if the qualitative data or outcomes are ignored. That's because while frequency of contact is important, even more critical is whether or not that individual's diabetes is under control, and whether or not he or she can monitor their sugar levels independently or take their medication successfully. That's the success we are constantly seeking, and it is what has made us the leading anti-poverty organization in the Midwest. Metrics are critical in helping us evaluate our work, understand what is successful, and what needs to change so that we can continue to have lasting impact on the lives of millions. We have 4 tools that we use regularly. First, we have a system in place to do our own internal monitoring. This occurs on a monthly basis, and it's an opportunity for program staff to present qualitative and quantitative data on the progress they are making toward meeting strategic goals. I personally review this data each month and look for areas of concern. Second, the research arm of our organization evaluates our program's effectiveness, documents successes, and quantifies unmet needs. These rigorous evaluations actively engage participants, staff, and administrators, and help us seek ways to innovate or improve existing programs. Third, and similar to our research arm, we also use external evaluators to review our program's effectiveness. The ability to employ third-party evaluators allows us to gain new perspectives on our work and our practices. And finally, during our annual strategic planning process, we take a deep and studied look into our programs. We identify successes and weaknesses. Then we determine where we want to grow as an organization and what it will take to get there. As I talk to our supporters and people within our community, there are a few misconceptions about Heartland Alliance that come up all the time. First of all, many people don't realize that our reach is global, and we have programs in more than 20 countries around the world. Many years ago, we realized the solutions we developed to address issues of poverty in Chicago and the Midwest had value and relevance in communities halfway around the world. Today, we are operating in places like Haiti, Burundi, Colombia, Ethiopia, and many, many more. Second, some people may not realize that our reach is wide. We serve more than 1 million people each year. Our dedicated staff of 1,300 and volunteer corps of 1,700 is made up of nurses, educators, lawyers, housing developers, and counselors, ensuring we're able to meet the needs of all of our participants, regardless of their circumstances. Last, we aren't always seen as firmly rooted in the communities where we work. That is simply not the case. We invest heavily in the capacities of local communities because having a strong community is the only way to ensure someone can remain financially stable and out of poverty. Our staff and leadership often participate in local neighborhood organizations, bringing our expertise to the table to help solve community issues. We also assist people we serve in becoming local leaders so their voices can be heard when decisions are being made about the future of their communities. We've accomplished so much in our 125 years, and I'll take the opportunity to name just a few of our significant achievements. First, we have launched several advocacy groups to address critical issues facing our communities. Entities like the Chicago Coalition for the Homeless, the AIDS Foundation of Chicago, the Illinois Poverty Commission, and the National Transitional Jobs Network. They were all birthed at Heartland Alliance because we realized we needed strong external partners, advocates helping to advance solutions to pressing issues like homelessness, HIV/AIDS, poverty, and joblessness. These entities are now strong advocacy and policy groups that are also impacting change in communities and giving a strong voice among legislators and decision makers. Second, many of our best practice initiatives are seen as national models and have been duplicated and replicated throughout the nation and around the world. One example is our treatment program devoted to the recovery and healing of individuals, families, and communities affected by torture overseas. Pioneered in Chicago by Heartland Alliance, this program has been exported to Latin America, the Middle East, and Africa. As a result of our ongoing work, we're now recognized as international experts in recovery from trauma. Third, we have launched one of the nation's most respected research and evaluation centers that provides information on contemporary social issues like healthcare, affordable housing, homelessness, and poverty. For more than 2 decades, Heartland Alliance's Social Impact Research Center has provided current, accurate, and objective data to policymakers, community leaders, and the media. As a result, Heartland Alliance is not only one of the largest service providers in the Midwest, we are also the leading voice on issues of poverty and other critical questions impacting our communities. Heartland Alliance is committed to being a flexible innovator, quickly developing new solutions as needs arise. This can be very challenging when working with government partners and bureaucratic systems that aren't able to move as quickly as we can. Oftentimes, we have to invest a lot of energy and time proving the need for response, and the inherent slowness can be frustrating. Take, for instance, the AIDS epidemic. We were one of the first organizations in Chicago that worked with individuals with HIV/AIDS, and we witnessed the devastating impact it was having in many of our communities. We pleaded for resources to help these individuals secure health care and housing, but their needs went unmet for years. That's when we helped create the AIDS Foundation of Chicago. If government partners were going to be slow to respond, we needed a strong community organization to fund and coordinate prevention, care, and advocacy projects. As a result, the AIDS Foundation of Chicago has raised millions of dollars to address these pressing issues, as well as advocate for new policy that help those impacted by the disease. Another time we had to prove a need for response was during Hurricane Katrina. We coordinated and led the largest Katrina relief initiative outside the Gulf Coast region and helped resettle thousands of families in the Chicago region who lost their homes in the flood. We knew that it would take federal and state governments too long to respond quickly, so we worked with corporations and the United Way to establish an emergency pool of private funds, and we hit the ground running. Heartland Alliance would make 2 significant investments with additional resources. First, like any organization or company, innovation is critical. Launching new pilot projects that support our best practices is how our organization can effectively respond to emerging crises. Unfortunately, innovation isn't what our government partners want to invest in, and we rely on private funders to help us develop new solutions as problems emerge. For example, we'd like to start offering family services for youth released from juvenile detention so we can break the cycle of delinquency. Second, we'd invest in additional evaluations of our pioneering models to ensure what we are doing is most effective. Third-party evaluators allow us to engage participants, staff, and administrators in ways that we can't internally. And this outside perspective allows us to seek ways where programs can be improved and helps drive innovation even more. Currently, we use outside evaluators when funders either require them or we are able to convince funders to include the cost of evaluation in our budgets. That results in 2 to 3 program evaluations each year. We'd like to have a robust evaluation program in which all of our programs are evaluated every 3 to 4 years, either through our internal research center or through external evaluators. Finally, we'd invest additional resources in advancing policy solutions with city, state, and federal legislators. The services we provide are making a world of difference in the lives we directly touch. However, we want to solve issues of poverty and danger, not only within our local communities, but throughout the nation and the world. We know that the only way to do that is to advocate for policies that protect vulnerable populations and help them connect with social support systems that keep them out of poverty. Heartland Alliance currently has 3 gaps that it does not fill. The first is adequate funding for professional development, both within our organization and the field in general. Our world moves quickly, and our staff needs to be able to learn new skills and adapt to changing environments. The second is to upgrade our management evaluation systems. We need robust information technology to help us continuously measure our outcomes and our impacts in real time. And third, we'd like to be able to share our solutions and models with a national and an international audience. Successful strategies developed in Chicago to help those impacted by HIV and AIDS are also effective in Nigeria and Ethiopia. Supportive housing projects for the homeless, like we've built in the Midwest, could help struggling cities throughout our nation. And community health centers we built in our city's neighborhoods could benefit communities everywhere. Increasing our ability to package, publish, and promote our strategies would not only allow us to have an even wider reach, but it would mean that even more people around the world would have opportunities to live a better and safer life.